And good morning, and here we go once again for our K3NowMD.com weekly update with Dr. Robert Kowalski. Good morning, Doctor.
Good morning. How you doing?
We do this weekly update every Tuesday, Wednesday, and Thursday right about this time, and so that some of our new listeners can find out who we're talking with, if you can give us a little bit about yourself and what is K3NowMD.com?
Sure. Well, myself, I'm a board-certified neurosurgeon and have an active clinical practice in neurosurgery here in the Tampa Bay area. But a side passion of mine has been exploring areas of wellness, and that started as myself a patient 10 years ago. And so wellness, among other things, includes making sure your endocrine system, which affects your hormones, is working properly. Testosterone replacement, which you hear a lot of, is just one small part of that. Your endocrine system also controls your thyroid gland. It controls your adrenal gland. Your thyroid gland controls your metabolism. Your adrenal gland controls your stress hormones. And so those are all important things to make sure that they're properly maintained in terms of increasing longevity and quality of life. And quite frankly, the endocrine system is ultimately under control by the brain. And so we've taken an approach in wellness utilizing our neuroscience background and trying to, from that perspective, make wellness easier for patients through improvements in the endocrine system. We do that through our wellness clinic, which is in 603 South Boulevard here in South Tampa. But again, we have the ability to see patients either by Skype or by FaceTime throughout the state, and even some patients throughout the country, and even some patients over the internet throughout the world.
Well, I got to tell you, just in the last couple of weeks that I've been working with you and the research and all the information that I've learned from you, that I found out for years now I have been going with low testosterone. And I thought about, my T is low, but big deal. It's not going to hurt me. I'm probably not going to have the sex drive. I'm not going to, be as aggressive as far as energy. But that's not true. It's pretty important to get this level back to where it's supposed to be. Is that correct?
Yes, I mean, again, as men, typically our testosterone level drops about 150 points a decade. And again, going back to the other parts of the endocrine system, those other systems may also be failing as well, but obviously testosterone is an obvious one. Testosterone in men will, helps you build lean muscle mass, avoids accumulation of abdominal fat. And again, just recently, they've found that there are testosterone receptors on almost every cell type in the body. And so it's doing things we're not even really aware of yet. And so obviously replacing your testosterone, and now we can replace it back to the level that it should be in your mid-20s. And so we no longer have to accept as just the normal part of aging, the loss of testosterone and those the negatives that come with it. So now the fact that we can do that, and there really is no downside to replacing testosterone. In about a third of patients, it may increase their red blood cell count, but that's easily remedied just by donating blood. Another issue is that your testosterone also affects your weight, and you see probably only second to testosterone ads, you see all these weight loss ads on TV and radio. One of the things is your testosterone and your estrogen, and as men we have estrogen just like women also have testosterone. But one way to think of it is that your testosterone and estrogen sort of set your weight almost like a thermostat sets the temperature in a room. And so if your hormones are such that, and your weight is some set by the hormones, you can try and fight that by dieting and exercise, and you may even have some success. But if you haven't fixed the underlying problem, and if there's an discrepancy in your endocrine system, you're really sort of fighting an uphill battle. And fixing the foundation, getting your estrogen and testosterone levels proper is going to go a long way, and maybe all you need to do. But certainly, if there's, you want to gain above that, any diet or exercise plan is going to work much better when your foundation, your core, your testosterone, your estrogen are at their proper levels.
So one set of hormones can affect, if it's low, affect the other hormones in your body. They all have to be balanced. Is that correct?
Correct. As I said, as men, we have estrogen, and it sort of balances our testosterone. So you need some estrogen. You don't want too much. Again, as a male, you could have normal testosterone and have your estrogen be too high, and you would still be estrogen dominant and still have all the symptoms of low testosterone. So they're important in balancing each other. And then also within the endocrine system, sometimes what's going on in your axis controlling your estrogen and testosterone can also affect your thyroid gland and can also affect your adrenal gland and your stress hormones. And so that's really important. a lot of the ads you see today on TV are for these so-called sort of testosterone clinics. All they do is testosterone replacement in men, and again, a certain percent of men are going to benefit from that, but they don't have the benefit of looking at the total picture. And as a full-service clinic, we can look at the entire endocrine system, and again, not to forget the other half of the population, but we also, 50% of our patients are females as well. So as our clinic takes care of everything, we really can provide that full service care. Some people need a little bit, some people need a lot, but if you go to a place that doesn't even provide those other services, I think you're really doing yourself a disservice.
Well, I got to tell you, it's a funny story here that a friend of mine heard that we were doing this show, and as a matter of fact, I think he listened in either last week or the first week, and he called me to let me know that he had went to one of the clinics where you just get the T shot, and he still didn't feel all exactly right, so he went to his doctor. His doctor said that your T is okay right now, but now your estrogen, you have not one bit of estrogen in your body, and he was kind of embarrassed to tell me that his doctor prescribed or wanted to prescribe him some estrogen, and he just got frustrated. And because he heard this show, he became a patient of yours, and he said one of the first things is that you guys did blood work and then you balanced out with T, estrogen, and something else.
Yeah, well, again, our first thing we do is listen to the patient and understand what their concerns are, what their symptoms are. And then obviously the next step is we have a pretty extensive laboratory profile that we perform. Again, it's a little bit tailored to each individual patient and what their individual concerns are. But obviously we're looking for a correlation, and typically we find one. Obviously, again, in men, it's often going to be low testosterone, but we often find, if people are suffering from low energy or other issues, then we often find a correlation with low numbers in the thyroid gland and thyroid function. And so we're sort of putting those together. The numbers give us some objective data, and that allows us to follow the patient. Ultimately, what matters most is the patient's quality of life, and so our primary goal is making sure the patients have the best quality of life they can, and then obviously we're also shooting for longevity as well. But again, that's a common thing when you go to some of these testosterone places. If they can give you testosterone, but if they're not providing that full comprehensive care and they're not watching your estrogen, and your estrogen goes too low or too high, that can really not only take away all the benefits you should be getting from the testosterone, it can actually take things in the other direction and cause you significant problems or harm.
Well, if you just tuned in, you're listening to Dr. Robert Kowalski. He is our doctor at K3NOWMD.com, and we are talking about how important it is to make sure that your hormones are balanced. And I got to tell you that he did also tell me that the treatment was completely opposite of what he got at, and I've called this before, at one of the, just a tea house where you just go in and they give you the shot and you're out the door, and it's just like an assembly line. But he said he raved about how the care and treatment was so completely different at your location in South Tampa.
Well, again, these other clinics have popped up because quite frankly, there's been a vacuum, and traditional medicine hasn't addressed some of these issues as well as it could or should have. And so when there's a vacuum, people are going to try and fill it. And so that's sort of what you're seeing happening. Unfortunately, when that happens, you're going to get some people doing it wrong just because they don't know what they're doing, some people doing it wrong because they're sort of more motivated by profit as a business. Then obviously there's some people out there doing it right. We obviously believe we fall into that latter category. But as a traditional physician and having traditional medicine practice, we also treat this much like a normal medical practice and use the same sort of standards and patient care. And another important aspect is that all of my staff started as patients themselves, including myself. So we've been on the other side of the desk, and almost everything that our patients would experience as they go through the treatment, we've experienced ourselves and can help them through that. There really are no downsides, but to the extent people have, sort of some issues, they're not sure if that's normal or they're experiencing something, we can walk them through it with our, sort of firsthand experience, literally.
Well, Dr. Kowalski, another quick 10-minute update as far as getting our hormones ready and right. Thanks to you, and we look forward to speaking to you every Tuesday, Wednesday, and Thursday right here on Money Talk 1010. We thank you for being part of the show, and if you could quickly tell us where you're located one more time.
Of course, our main office is on 603 South Boulevard in South Tampa, and anyone can reach us. Our website is www.K3NOWMD.com. Again, K3 Neuroscience Optimized Wellness. Find us on the internet, and we're available email, internet, in person, whatever is most convenient for patients.
Thank you very much. Have a great day, and we'll see you soon.
Thanks, you too.